All right, the new numbers are out. The government just dropped the official Medicare costs for 2026. So today, we're going to break down what this actually means for your wallet. So what's Medicare really going to cost you in 2026? Let's dive right into the key numbers that'll affect your budget, and we'll start with hospital insurance. Okay, so first on the list is Medicare Part A. You can think of this as the part that covers the big stuff, like inpatient hospital care or if you need to be in a skilled nursing facility. And right off the bat, we've got some fantastic news for most folks. You see that big 99%? That means the vast majority of people on Medicare pay absolutely nothing, $0 for their Part A premium each month. As long as you or your spouse worked and paid Medicare taxes for about 10 years, you're probably in that group. And this is a really big but. Just because the premium is free doesn't mean Part A is totally free. The costs you really need to plan for are the ones that pop up when you actually need care, like your deductible if you're hospitalized. So here's the deal. If you find yourself admitted to a hospital in 2026, this is the first number you'll have to deal with, the Part A deductible. And for 2026, it's going to be $1,736. That's up $60 from what it was in 2025. Now, the good thing is that one single payment covers your first 60 days of inpatient hospital care. So you pay it once and you're covered for that initial stretch. But what happens if you need to stay in the hospital longer? Well, that's when coinsurance kicks in. For days 61 to 90, you're looking at $434 a day. After that, you start dipping into what are called your lifetime reserve days, and that cost jumps to a whopping $868 a day. It's a similar idea for skilled nursing. After the first 20 days, you start paying a daily amount there too. Okay, let's switch gears and talk about Part B. This is the part of Medicare you'll probably use a lot more often. It covers all your day-to-day medical needs. Think doctor visits, lab work, and that sort of outpatient care. All right, this next number is a big one. For a lot of people, this is the one that really matters. The new standard monthly premium for Part B in 2026 is going to be $202.90. So that's an increase of almost $18 a month from the previous year. And for most of you, this is the amount that'll come right out of your Social Security check every month. Next up is your annual deductible for Part B. You can think of this as what you have to pay out of pocket first, before Medicare starts to chip in for your care. For 2026, that amount is $283. Yep, that's gone up by $26 for the year compared to 2025. Once you meet that deductible, then your coverage really starts to kick in. Now, hold on. For some of you, that standard premium we just talked about isn't the whole story. If you have a higher income, well, you're actually going to be paying a higher monthly premium. This extra charge has a fancy name, the Income-Related Monthly Adjustment Amount, or IRMA for short. Basically, if your income is over a certain limit, you pay more. And the way they figure this out is by looking at the tax return you filed 2 years ago. Now, before you start to worry, this doesn't hit everyone, not by a long shot. It actually only affects about 8% of people on Medicare. So the vast majority, 92% of folks, will just pay that standard premium we already went over. So let's take a quick look at how this works. For this example, we're looking at people who file their taxes jointly. You can see if your income is up to $218,000, you pay that standard premium. But as soon as you go over that line, your premium jumps up. And as your income climbs, so does your payment. And this is really important to remember. This same idea applies to your Part D prescription drug plan too. So it's not just about Part B. Higher earners will also see an extra charge for their drug coverage. Let's see how that looks. This chart shows the extra amount that gets tacked on to whatever your normal Part D premium is. So again, for joint filers, if your income is in that first tier above the base, you're paying an extra $14.50 a month on top of your plan's regular cost. Whew, okay, that was a lot of numbers. I know. So let's just take a breath and boil it all down. If you're a typical Medicare beneficiary, what are the 3 key numbers you absolutely need to remember for 2026? First up, that standard Part B monthly premium. It's $202.90. Think of this as your regular, ongoing cost for your doctor and outpatient coverage. Second, your annual Part B deductible. That's $283. You'll pay this once per year out of pocket before Medicare really starts picking up its share of the tab. And third, the big one, your Part A hospital deductible. If you get admitted to a hospital, you're looking at $1,736 for that stay. So now that you've got the numbers, the real question is, what are you going to do with them? Are these new costs already factored into your budget for 2026? It's definitely something to think about just to make sure you're ready for the year ahead. Thanks for joining me for this explainer.